The other option to do lumbar traction is to put patients in this prone position. We found benefit and success in either the supine or the prone position. So again, it's going to be based on the comfort of the patient. Some patients like to be more comfortable in the supine position, some of them more in the prone position. But the benefit of traction, it does occur whichever position you put the patients in. So again, based on patient comfort or based on your typical practice setting or your practice philosophy and how you determine how you're going to set up your patients. When we get patients ready and put them in the prone position, similarly we can use that navel as a marker, and it goes just below the V portion here in the belting system. In any event, the non-skid surface still wants to be above the iliac crest, so as we start to pull, same thing in the supine position, if it slides, at least it's going to slide and it's going to catch on the iliac crest. So you'll see here again with her iliac crest, we're above the halfway mark on this non-skid position. Essentially we would do the same thing as we would do in the supine position as far as breathing goes, and to make sure that we just eliminate any excess air in the abdominal cavity and the thoracic cavity when we're attaching patients to the device. Same thing, we'll also use the lumbar belting system as a must, but we can use the thoracic piece as well to make sure that patients aren't going to slide. Same thing, we're going to use that conical effect, so it's going to go at an angle and it will catch patients down in that position if they were in fact to slide. Take a breath in for me. And out. Another breath in and out. Same as in the supine position, we want that O-ring to be right in the center, and the next step will be to attach the pulling device. As we attach the thoracic piece, it might cover up, so that's just the natural progression to the process. Same thing, we want to have this in a curled fashion. We want to make sure that we don't have any bunching up here. Take a breath in and out. So we get overlap in the oblique and we don't get bunching up to the front. We have another option that we can do with people in this prone position, and that's to use the grab bars, especially for larger people that have longer torsos that may not fit as well in the thoracic piece when they're in this prone position. So it's adjustable at different lengths, and again, that will meet the needs of the patient. What we don't want them is to have to hold on too tightly, so we like them to be in a fairly relaxed position or comfortable position, and it's really just as a guidance to make sure that they don't do any sliding. So we don't ask patients to grab too excessively. So adjusting for the patient comfort as well as adjusting for the position of the patient, we just ask them to place their hands on there. And again, it's just another supportive mechanism that we can use to keep them from sliding back down. Same process of attaching the pulley system. Now, from this position, just because of the nature of the belting system and their anatomy as they're sitting up on this table, we really only do patients in this prone position from about 0 degrees. So you can see there's a guide in here that tells you the angle of the rope system relative to the patient and relative to the table. So the way that we change the angle is actually by changing the height of the table. So again, looking at the guide, if we were to go too far at an angle, it actually changes some of the mechanics, and we don't get as much distraction in that posterior pelvic tilt or the reduction of the lordosis, and it may actually cause increase in extension in some patients. And if that's something that we wanted to avoid, then we want to make sure that we stay somewhere between the 0 and the 20-degree mark.